while ago. Today I will be going to demonstrate the proper way of taking the vital signs. So first we will determine the client. So I have Ranjit Tamayo as my client in taking the vital signs because he had an order by the doctor that I should take the vital signs on a regular basis. Next, we should explain the detail of the procedure and rationale to the client so that we could gain cooperation and he will have an understanding that we would be performing to him. So don't forget to greet to the client to have a positive impact. After that, you would state his name or look for the hospital identifier. Ask the patient if he has strenuous activities performed for the last 15 to 20 minutes. If there are activities that being done of the patient, we should take him as rest for 10 to 15 minutes in order to prevent any alternate result. Then, I will going to expose his deltoid area where I'm going to put the thermometer. But before we start, I should get a towel and use for 3 folds in my palm. Then create a square folds. This is to prevent any contamination. So 3 folds. 1, 2, 3. Then create a square folds by folding it. Then smoothly pat dry the axillaria of the patient, then discard the towel. Then discard the towel. Then get the functional thermometer and the cotton with alcohol as well. So I should get single cotton ball and put alcohol. Then the functional thermometer. Then disinfect first the thermometer from sensor going to base and do it in circular motion. Then sensor to base. Then get dry cotton to dry it. Then from sensor again, then circular motion to the base. After that, place it at the center of axilla. Then assist the patient that he would place his hand to the abdominal area. Then go to the other side while waiting the result and get the pulse rate. And prepare any timers I have watched. And using the 2 or 3 fingers to palpate for the radial pulse, then get 1 full minute in taking the pulse. Then, assuming that we are done taking the pulse, after that, I will going to get the respiratory rate. Then, reminder that never remove the 3 fingers to his radial pulse. This is to prevent from having a conscious and normalized effort of breathing. Then I am going the rise and fall of the chest for 1 full minute and determine if the patient is having difficulty of breathing. The normal respiratory rate should be 12 to 20 breaths per minute. Then assuming that we are done, I'm going to make the patient comfortable. Then after that, go back to the exact position. Then get the thermometer and clean it with cotton balls and dry, as we did lately. Get some cotton balls and put some alcohol. Clean it from the sensor to the base in circular motion. Then get another balls, cotton balls, in order to dry it. From sensor to base again in circular motion. Then place it to the clean area. Now I'm done taking the temperature and also the pulse respiratory rate. Then ask the patient's condition. Also ask him if there is any concern about his situation. Then let us proceed taking the BP, or that should be called blood pressure. So the blood pressure test will be done after taking the temperature, pulse, and respiratory rate. We proceed in taking blood pressure. So the first thing that we need to do is to ask the patient if he has strenuous activities performed for the last 15 to 20 minutes, as like we did. And if there are activities that being done of the patient, we should take him a rest for 10 to 15 minutes in order to prevent any alternative result. Make sure that the patient is comfortable. And also, the hands should be at the side and the palm facing upward. Then this time, I'm going to put the speedometer. First, we should fold the sleeves of the patient. Again. Then, palpate the breakout pulse by using 2 fingers in determining the integrity of the pulse. Now, I'm going to put my speedometer. It should be placed 2.5 cm above the antecubital fossa. So you have to use your first, second, and the half third layers of your index finger to measure it. Then put the beeping cap lightly. Make sure that the arrow should be facing into the breakout pulse, and the line should be lightly straightened into the arms. Then the artery should be placed at the breakout pulse. Next, align the two lines should be lightly straightened. Then, the chamber should be perpendicular view of the patient and vertically to me. Then we can ask the patient to hold it properly in order to avoid falling the chamber. Then make sure that the pressure valve is closed. Next, get the stethoscope and make sure that the flat disc doesn't touch any surfaces to prevent contamination. Then I'm going to wear it properly. Then warm it using my palm in circular motion to prevent startling the patient. Then place it into the radial pulse. Then I will use my 3 fingers in maintaining the stethoscope into the brachial area. Next one. Next is to inflate the pressure valve. Then ask the patient not to speak during the procedure. Then inflate the pressure valve. So I've heard my first sound in 125 millimeter per mercury, and we should add 30, and we stop at 155. This is the clinical margin. Then slowly deflate the pressure valve. And hearing the last sound, which serves as the relaxation. So I'm going to release it 2 to 3 millimeter per mercury so that the last sounds will be heard accordingly. Then I will going to deflate it to release the vacuum until 10 millimeter per mercury. After that, I will going to remove my stethoscope and place it to my neck. Then make sure the this surface is improper. Then make the patient comfortable. Then remove it all. And lastly, determining for the result, and refer to the physician to explain necessarily the health intervention to my patient and document all the findings, my TPR BP and auto saturation to the ATPR sheet. That would be all. Thank you.